Um, I want to go ahead and welcome everybody here. Thank you so much for watching us, and thank you so much for coming to hear us. I appreciate everybody and every person that coming here to see us. I want to introduce myself. My name is Youssef Beshai, one of the family physicians here in California, one of the states in USA. I want to welcome everybody. I want to especially thank Grace, the social and medical services that they do for people. Thank you so much for inviting me, and thank you so much for bringing me here to be with the people and to go ahead and just answer any kind of questions about the most important virus that we've been facing for the last couple of months about COVID-19. I want to welcome everybody. Thank you so much for having me. First, I would like to go ahead and just introduce myself. As I said, I'm Dr. Youssef Beshai, one of the family physicians. I'll be happy to go ahead and answer any kind of questions if you guys have any questions at the end of the lectures, or if at any time you want to go ahead and just post your questions in the Grace website, I'll be happy to go ahead and answer the questions at any time, or at the Facebook page or at the YouTube page, or any kind of you can go ahead and just put your questions, and I'll be happy to answer at any time. You have Grace's phone number, and we'll be happy to answer any kind of question that you do have. COVID-19 is a virus that we start to hear about in December 2019. We've been knowing these kind of viruses since 1960. We know the first coronavirus in 1960, and we've been having these kind of viruses every once in a while, like SARS in 2002, and like the Middle Eastern respiratory syndrome in 2012. And finally, we got this coronavirus 2019, which is getting spread and is getting all over the world. And definitely coronavirus is very serious illness and very serious problem. We want to go ahead and just take it as a serious problem. We don't want to go ahead and take it as a light problems. So be serious with this. In the meanwhile, we don't want to go ahead and have fear and an anxiety about it in the meanwhile. So we want to go ahead and just be in the middle. We go ahead and take it seriously because it is a problem that we've been facing for the last couple of months. But in the meanwhile, we don't want to go ahead and just have panic attacks about it, as well as an anxiety about it, because that's going to go ahead and put us in fear. And you need to know that fear and an anxiety can decrease your immunity and can go ahead and just put you in more complications for these viruses more than anything else. We thought that this kind of coronavirus will spread from animals to human being, but right now we feel like it is coming from human being to human being, and it's spreading all over the world. As we know, we know the first case in Wuhan, China, in December 2019, and then start to spread to Italy, to Iran, to Japan, to South Korea, as well as to Spain, and finally in the United States of America, because we've been having a lot of cases so far. So right now we do have almost 500,000 people that they got infected with coronavirus, with almost 25,000 deaths so far from these coronavirus. And we have 1,000 deaths in the United States, and we have almost 100,000 cases confirmed coronavirus in the United States. So as I said, we don't want to go ahead and take it light, and in the meanwhile, we don't want to go ahead and have an anxiety. So these kind of viruses and RNA viruses, once these RNA viruses invade the body, will go ahead and just enter the cells of the human being. And in these situations, those kind of viruses will go ahead and just control the cells and try to go ahead and just have the nutrition that they want from the normal cells, and replicate and form thousands and millions of viruses that will spread and to go ahead and just destroy a lot of cells inside the body. Once these kind of body enter the body, once these kind of viruses enter the body, we'll go ahead and start to have the normal cells to be under the control of the viruses. How can we get these viruses? We get these viruses from the respiratory droplets, from sneezing or from coughing, by touching these kind of viruses from any kind of surfaces. And once we touch our eyes, our mouth, or our nose, we can go ahead and have these kind of viruses to go ahead and enter inside the body. So that's why if we prevent touching these kind of opening or cover these kind of opening in our bodies, that will go ahead and prevent transmitting these viruses from any surfaces to our body through our eyes or mouth or nose. Once these kind of viruses enter, we're going to go ahead and start to have some symptoms, okay? And these kind of symptoms will start with go ahead and have a very high fever. Fatigue, weakness, sleepiness, I want to sleep all the time, and fever. And the fever always reach from 38 to 40 degrees centigrade, or from 102, 103 Fahrenheit, if we're going to go ahead and just measure it with the Fahrenheit. Okay, so any one of these kind of measurement, that will be the first kind of symptoms that we have is chills, fever, weak, and fatigue. And then we start to go, the viruses will go ahead and go to our nose, start to go ahead and have a little bit of itchy nose as well as itchy throat. And then we're going to have sore throat or pain in our throat. And then those viruses will go to our lungs. Sometimes it can go ahead and cause very mild cases, and sometimes it can go ahead and be very severe cases, okay? Mild cases like very low grade fever, a little bit of runny nose, a little bit of cough, everything will be okay within 2 to 3 weeks, okay? And I'm going to be okay within these kind of time. But sometimes it can go ahead and cause me to have really severe cases, okay? So the fever will go ahead and persist more than 2 to 3 days. The cough will go ahead and persist more than 2 weeks. And then I'm going to go ahead and start really bad chest pain, shortness of breath, okay? Shortness of breath. So at any time I'll go ahead and just get these kind of symptoms, I don't have to go ahead and be panicky, because these symptoms we get, everybody go ahead and get these kind of symptoms, okay? So it could be just a very mild symptom, and it could be severe symptoms. So we don't want to go ahead and run right away to the hospital, to the emergency room, to the clinics of the doctors, to go ahead and call my primary care physicians or my doctors right away. If I do have a very mild case is very simple. You can go ahead and just treat, and you can go ahead and stay home, and there is no problem. But there is red flag symptoms that we can go ahead and just have, which will go ahead and just let me seek medical attentions right away. If the fever persists, if the fever doesn't go away with the medications, if I do have at any time shortness of breath. So I cannot, if I have dyspnea, if I have difficulty breathing, if I cannot take my breath, if my oxygen starts to go ahead and be low, I need to go ahead and run to the closest hospital, to the emergency room. I need to call my doctors. I need to know exactly, because this is red flag, because as I said, these viruses can go ahead and cause me to have very simple symptoms or very hard symptoms, very mild case or very severe cases up to death. Okay, and as you see, there is very big difference between the flu and the coronavirus, because the death from the flu is 0.1%. The death from the coronavirus is about almost 3 to 4%. So coronavirus can go ahead and cause more serious illnesses than the regular flu. As I said, we don't want to go ahead and take it lightly, but in the meanwhile, I want to go ahead and just don't be panicky and having an anxiety. Once those kind of symptoms, as a person, I have to go ahead and just know if it is a mild case, I need to stay home. If it is a severe case or very stressful case with severe shortness of breath, I need to go ahead and seek medical attention. To go ahead and go to the emergency room, or to go ahead and call my doctor to seek the attentions of these doctors. So how can I diagnose? How can we diagnose these kind of coronavirus? Right now we do have tests, and we do have a new test that coming actually today. The old test, which what we call the nasopharyngeal swab, the swab that I go ahead and put in my nose or my throat and send it to the lab, and I do something called PCR, which is going to go ahead and just the results always comes between 5 to 7 days, and sometimes take longer, okay, which is an old method that we can go ahead and just do. But today the FDA or the drug administrations in US approved a new test that I can go ahead and get results within a couple of minutes, okay, which is very good. It's going to be in the market maybe by the next week, okay, which is going to go ahead and be easy way to go ahead and just diagnose the coronavirus. So if I do have severe illness, I need to be tested. We changed the criteria a little bit for the last couple of days about testing, okay, because not everybody that has mild case need to be tested. So I can go ahead and have a little bit of low-grade fever, a little bit of cough. If I'm strong, I don't have shortness of breath, there is no need for me to be tested. There is no need for me to go ahead and go stand in line to go ahead and just do a test. If I do have severe case, like I start to go ahead and have shortness of breath and have difficulty, or I got exposed to a positive case of COVID-19, or I do have somebody that came with positive test. Even right now they changed. If I got exposed to a person that has COVID-19, we used to go ahead and screen just to make sure that you don't have. But right now that they said even if you got exposed to COVID-19 or a positive case, if you don't have symptoms, there is no need for test. If you don't have fever, there is no need for test. If you don't have shortness of breath and cough really bad, you don't have to go ahead and just be tested. So we test only the severe cases right now that they do have really high fever that persist, as well as shortness of breath and cough. What's the difference again between the COVID-19 and the flu? We know the flu for a long time. COVID-19, this is a very new strain that we just know about in 2019. So we don't have a lot of research about it. We don't have a lot of papers about it. We don't have a lot of medications about it, and we don't have any kind of studies about the effect of this coronavirus in our body. But we know the flu for a long time, and we have a lot of study for a long time. Flu vaccine, we do have the flu vaccine for the flu. We don't have any vaccinations yet for COVID-19. We're working on it, and hopefully within 6 to 9 months, we're going to go ahead and get some vaccinations to vaccinate everybody against the COVID-19. There is some medication that work with the flu. It's not going to work for the COVID-19, like Tamiflu, for example. And I heard that some doctors that go ahead and use Tamiflu, it's not working with COVID-19, and it will not work with COVID-19. But there is some medication that some doctors and some studies start to use, and we've been using, okay, here in the States, which is, it's not approved yet, but we've been using off-label, and it's been working, which is the combination between hydroxychloroquine and azithromycin. Hydroxychloroquine in a dose of 200 milligram twice a day for 10 days, and azithromycin for 500 milligram once a day, to go ahead and we see a good study that prove that those kind of combination together will work, and that will most probably success rate about 99% of controlling these kind of viruses in the body. There is a new medications that working antiviral medication. They're working on it until now, but we don't have studies yet be completed to go ahead and have approve it. But there is a good positive data that will come very soon, that we are going to go ahead and have an antiviral medications that will protect against COVID-19. And there is another study that going on right now to go ahead and use the serum of the infected person. So the mild cases, they get exposed, the body will form some antibodies. If I get this kind of blood from donation from these persons, I get the serum will have antibodies against those COVID-19 kind of viruses. If I can inject those kind of serum to a sick person, right now there is a study going on that will go ahead and protect those kind of new people, that they will go ahead and get injected with these serums, with these antibodies, to protect them against these viruses. All of these are studies. We don't have any confirmed data to go ahead and just do, but the only combination that we've been using, and we do have a good success, is the hydroxychloroquine and azithromycin. It's off-label. It is not approved yet, but hopefully very soon we can go ahead and just approve it. But there is a vaccine that the company is working on it, and it's going to be available. I heard about 6 to 12 months. It's going to go ahead and just be available in the market. And in those situations, we will vaccinate everybody against COVID-19. Uh, because it is virus, definitely, and we don't have definite treatment for, the most important thing that I want to go ahead and leave with you guys is to how to prevent spreading these viruses, which is very important. How can, as a person, prevent from transmitting these viruses from me to another person? And this is the most important thing. And this is the thing that we educate everybody from. Please separate yourself. If I am sick, please isolate yourself. So isolation is very important to go ahead and just prevent those kind of viruses from transmitting from one person to another person. So if I am sick, I need to go ahead and keep myself in the room. I need to go ahead and lock myself. I'm going to go ahead and eat and drink in my room, use my own utensils. I'm not going to share utensils with people. I'm not going to share plates with people. I'm not going to go ahead and share any kind of cups or anything like that with people to prevent the transmitting of these kind of infections from me to another person. So right now we said, please wash your hands very good. If you cough, you go ahead and use a piece of napkin, and then once you cough, don't put your mouth in front of your mouth. No, don't put your hand in front of your mouth. Just put a piece of cloth or a piece of napkin or tissue to go ahead and cough in it, and then throw it in the trash. Wash your hands about 5 to 6, 7 times. Regular water with a little bit of soap, warm water, that's going to be sufficient to kill these kind of viruses. Use antiseptic. Antiseptic, some liquids or something that we go ahead and clean the surface as well with like Lysols or antibacterial soaps, or something that we can go ahead and clean the surfaces with. It's very important because that will go ahead and just kill the viruses. Those viruses will stay on the surfaces from hours to days. So I can go ahead and cough on my table, and I leave these viruses to live on my table for a couple of hours. So if I'm going to clean my table every once in a while with antiseptic lotions, okay, or antiseptic soap, that will go ahead and just kill these kind of viruses right away. Eat a lot of vegetables, eat a lot of proteins, okay, a lot of fruits, okay, drink a lot of waters, okay. Probiotic is going to be helpful to increase your immunity. Try to go ahead and have some social distancing, okay. I don't want to go ahead and just be close together in one room. Try to go ahead and just talk to people away, as well as be separated from people. So social distancing is very important to go ahead and just prevent transmitting these kind of viruses from one person to another person. So we talk about the symptoms, we talk about how to diagnose, we talk about the treatment options that we have so far, but the most important thing is preventions. So how to prevent the spread these viruses from one person to another person. So we have to go ahead and just try our best as people to go ahead and just prevent social gathering together, to go ahead and just prevent spreading the viruses from one person to another person. For me as a person, I try to go ahead and increase my immunity by eating a lot of vegetables, fruits, hydrate myself with water, as well as a lot of liquid. Some vitamins are very good in increasing my immunity, like vitamin C, 500 milligram to 1000 milligram once a day, and vitamin D, like 2000 international unit once a day. Vitamin B6, 50 milligram once a day. Some zinc or vitamin that has zinc in it, that will go ahead and increase my immunity, plus hydrating myself, doing my exercise, that will prevent me from having severe illnesses, as well as prevent me to go ahead and just have any other illnesses and increase my immunity. I want to, at the end, thank you guys so much for listening to us. Please, we have to go ahead and pray together that God will go ahead and have mercy on us, to go ahead and just have this time to pass without any kind of complications or any kind of disaster that happened to the human being. We pray together, and we go ahead and just have God to have mercy on us all. We thank you so much for listening, and if you do have any question, please send it to us, and we'll be happy to answer as much as we can. We're going to go ahead and just come back again to update you guys at any time soon. And thank you. God bless you.